Hi viewers, you are welcome to ABKM Medics and also welcome to today's class. In today's class we're going to talk about the identification of medical and surgical instruments part 2. Remember in our previous class we talked about introduction of medical and surgical instrument part 1. So today's class is going to be part 2. Before we proceed, let me remind you that these instruments are named based on their function and also their discovery, meaning the person that discovered them. And most of the functions of this instrument are of two types. We have the primary functions and we have the secondary function, meaning some of them can be used more than one times, meaning more than one procedure. These instruments, some of them, their mode of treatment is by sterilization, while some are by disinfection. Here you disinfect to reduce the number on the strength of the microorganisms, while by killing off the membranes of the microorganisms. While by sterilization, here you kill the microorganisms entirely by killing the membrane or by destroying the membrane and the pores of the microorganisms. So, with me here I'm having few instruments which we are going to identify and also going to state their functions. This was the last instrument we identified in our last class. Here I call it abdominal retractor. This instrument is used to hold the abdominal tissues in position during surgery for easy accessibility of the abdominal cavity. Here this is two abdominal retractor. One we have the Balfour abdominal retractor. When it's like this, we call it Balfour abdominal retractor. But what if I dismantle it? Here it is called Sims abdominal retractor. This can be used and the other one can be used depending on the conveniences of the surgeon. These two are used to hold the abdominal wall in position, widening the abdominal wall in position for easy access into the abdominal cavity. Here I'm having artery forceps. This is what we call artery forceps. This artery forceps, it is used to climb the arteries during surgery. A situation where artery is cut down, here you climb the artery. You can see it's having a hook where you climb the artery to arrest bleeding. And this artery forceps comes in different sizes. We have the small one, we have the middle size, and we have the bigger size. And it comes in different shape. Here we have the straight artery forceps. Here we have the curved artery forceps. They are all used for the same purpose. The curved artery forceps, it is used to climb the arteries, especially the arteries in hollow organs. Organs that are inward, in which straight artery forceps cannot access. Here you make use of curved artery forceps. Here this is another instrument called the needle holder. This is the instrument where you put or you hold your needles during surgery. You don't use your hands to hold needle during surgery, rather you use this instrument called needle holder. When you look at it, by look it's just like artery forceps. They are having a little similarities, but there are differences, especially when it comes to the edge. There is a space here provided that holds needle, and that is why it's called needle holder. Use it to hold needle for suture. Then here with me I'm having fetoscope. We have fetoscope. This is an instrument used in hearing the fetal heartbeats during pregnancy. Here you use this instrument to hear the fetal heartbeat, and that is why it's called the fetoscope. Here is another instrument called the turning fork. This instrument is used for neurological examination, especially the ears examination. For those that don't hear much, here you put, then you listen. It produces a sound, and that is why it's used for ear examination. Here with me is episiotomy scissors. This is what we call the episiotomy scissors. This scissors is used in cutting the skin and the tissues of the perineal area during labor for easy passage of the baby, and that is why it's called the episiotomy scissors. It's a procedure. Here is called the sponge holding forceps. This sponge holding forceps, it is used during wound dressing to hold down the gauze in order for proper dressing, or it is also used in holding the tissues during surgery. Like I said earlier, these instruments are having their primary functions and their secondary function. Then here we have the mouth gag. This is what we call the mouth gag. This mouth gag is used in certain procedures like oral care to widen the mouth or to expose the mouth, or for oral examination. Here you use it to widen the mouth so as to access the oral cavity easily, and it's made up of type. Here with me it is called the Doyne's mouth gag. Doyne's mouth gag. There is other mouth gag aside from this called Ferguson mouth gag. Here I don't have the instrument here, but the one I'm having here with me is the Doyne's mouth gag. This is what it is called, and this instrument, it is used to open the mouth for easy accessibility of the oral cavity. This comes to an end of today's class. When we meet in the next class, we're going to talk more on this instrument and their uses. Please, for more of this video, don't forget to subscribe to my YouTube channel at ABKM Medics. Also to like my Facebook page. Also to comment on my Facebook page at ABKM Lecture. Then also don't forget to follow me on Instagram at ABKM Lectures. Thank you for today's class. Call it a day.